The fluorescent lights hummed their electronic prayer over the nurses' station at Sacred Heart Hospital in Raleigh, and Hannah Clarke refilled the water pitcher without lifting her eyes. 3 years. She'd been walking these hallways for 3 years, arriving at 5:38 a.m., leaving at 7:15 p.m., speaking only when protocol required it. The other nurses had stopped trying to include her in lunch conversations by month 2. They thought she was shy. They thought she was timid. They thought she was just a floor nurse who'd landed a job slightly above her actual competence level. They didn't know that her hands, small and pale above the water pitcher, had once held a wounded Marine's intestines together for 43 minutes while artillery fire shook the concrete walls around them. They didn't know that the slight tremor in her fingers when ambulance sirens wailed wasn't anxiety, it was muscle memory. The body remembering. The mind refusing to forget. Hannah moved through Sacred Heart the way she'd learned to move through the streets of Tikrit, present but invisible, aware of every exit, cataloguing every person in the room by threat level before they'd finished saying hello. Old habits. The kind that didn't die just because you hung up your dress blues and decided to disappear into the American healthcare system when nobody asked questions about the scars on your left shoulder or why you woke up gasping at 3 a.m. The photograph in her badge holder was wrapped in laminate and folded 3 times. She never let anyone see it. The other nurses assumed it was a family photo, a parent, maybe, or a child she'd left behind somewhere. They couldn't have known it was a man's face. A man whose eyes were the color of winter water. A man whose name she whispered only alone, in her apartment at 2:24 a.m., staring at the ceiling and counting her heartbeats like they were ammunition rounds. She wore scrubs 2 sizes too large because it was easier to move in them, easier to slip through crowded hallways without drawing attention. Her hair was pulled back in the same tight bun every single day, tight enough to pull the skin at her temples, tight enough that nobody noticed the scar running along her left temple like a lightning bolt. That scar had a story. A story from Kandahar. A story from 17 years ago. A story that would end her career at Sacred Heart the moment anyone asked about it. The water pitcher was nearly full when Dr. James Hargrove swept through the nurses' station doors at 7:15 a.m. on a Tuesday morning, his white coat billowing like a cape, his reputation preceding him the way smoke precedes fire. He'd transferred from Duke University Medical Center 3 weeks ago, a pulmonologist with 3 published papers and the kind of arrogance that came from being right more often than he was wrong. His shoes clicked against the tile with the precision of a metronome. Everything about him announced importance. Hannah didn't look up. "Excuse me," Hargrove said, his voice the texture of polished mahogany, the kind of voice that expected to be obeyed. "The Foley kit in Bay 3. It's expired." Hannah set down the pitcher. "I'll check it." "You're the new floor nurse." "Not a question." 3 years, Hannah said quietly. 3 years and you still don't know basic inventory protocol. Hargrove moved closer, and the air around him seemed to compress. "What's your name?" "Hannah Clarke." He didn't respond. He was looking at something past her, a resident, a med student, the reflected light in her eyes. When he finally spoke again, his voice had the flat certainty of someone who'd already decided what you were before you opened your mouth. "Make sure the supplies are current. We do things correctly here at Sacred Heart." He left. The nurses' station exhaled. But that wasn't the beginning. The beginning was 3 months earlier, during a morning shift that had started like any other, fluorescent lights like surgical theaters, the smell of antiseptic sharp enough to cut through coffee and exhaustion, the constant beep of monitors in the distance like a city's electronic heartbeat. Hargrove had been consulting on a patient in the ICU. Hannah had caught an error in his dosage calculation, a simple math mistake that would have killed someone within the hour. She'd walked up to him, not confronted him, not embarrassed him. She'd simply whispered the correction quietly, where only he could hear it, before the resident entered the room. He'd gone absolutely still. For 3 seconds, nothing. Then he'd straightened his white coat and walked past her as if she were a piece of equipment. But his jaw had clenched. His fingers had curled into fists. And from that moment forward, every interaction between them had carried the weight of something unspoken, the kind of tension that builds when someone has been corrected by someone they'd already decided was beneath them. Hannah's locker was on the 3rd floor, down a corridor most people never used. It was tucked behind the break room, away from the main traffic of the hospital. She'd chosen it deliberately. Privacy. Distance. The kind of invisibility that had kept her alive in places where visibility meant death. Inside the locker, beneath her spare scrubs and a container of ibuprofen and a paperback novel with a cracked spine, sat a black duffel bag. The bag was small, the size of a travel kit, and it was laced closed with cord that hadn't been opened in 3 years. Inside that bag were things she'd promised herself she would never look at again: a pair of worn combat boots. Desert tan. Scarred. Caked with sand that had never quite washed out completely, embedded in the treads like memories that wouldn't leave. The boots had traveled with her through Fallujah and Kandahar and Sanjan Valley. They'd walked through 3 continents. 3 wars. And now they sat in a black bag in a hospital locker in North Carolina, waiting for a life that would never come back. The boots had a name stitched inside them. Not her name. The other name. The one she'd buried along with the uniform. Hannah closed the locker and walked back downstairs. The morning shift was picking up, the steady rhythm of hospital life that had become her refuge. The ER wasn't chaos to her. It was structure. Protocol. Every crisis a puzzle with known variables and predictable solutions. Nothing in the hospital came close to the kind of crisis she'd weathered. A collapsed lung was manageable. A hemorrhage was manageable. The human body's mechanics were simple compared to the machinery of military medicine: the constant triage, the impossible choices, the patients you knew you couldn't save so you moved on to the ones you could. At 10:33 a.m., a patient in Bay 7 coded. Hannah was there before anyone else, 2 steps ahead of the code team, anticipating what would be needed before the monitor flatlined. Her hands moved with the kind of precision that came from a lifetime of knowing exactly where every piece of equipment belonged. She'd started and 4 in a vein so collapsed the patient shouldn't have even had a pulse, and she'd done it in 3 attempts, her fingers dancing across the anatomy like they were reading Braille. "Nice work," one of the attending physicians said. He was young, maybe 40. His name was Dr. Marcus Webb. Hannah nodded. "Just training." That was more than training, Webb said. That was experience. She didn't respond. She didn't tell him about the combat medicine certification. She didn't tell him about the years spent in a place where medical equipment failed every single day and you had to improvise, had to make do, had to save lives with whatever was available in a concrete room with bullet holes in the walls. She just documented the 4 placement and moved on to the next patient. By noon, Hargrove had heard about the code. He'd heard that Hannah Clarke had started the 4. He'd heard that the attending physician had praised her work. And when he passed her at the medication cart at 1:15 p.m., his eyes carried something that looked like the beginning of something else, the first small seed of a recognition he wasn't ready to acknowledge. But then his gaze moved down her scrubs, to her shoes, to her overall presence, and whatever he'd almost recognized died. She was still just the timid floor nurse. Still just the girl who'd had the audacity to correct him 3 months ago. Still just someone he could dismiss with a glance and a professional smile that didn't reach his eyes. "Good work today, Ms. Clarke," he said, and his voice was a knife wrapped in velvet. "Don't let it go to your head." Hannah took a measured breath. In. Out. The kind of breathing she'd learned in spaces where hyperventilation meant death. The kind of composure that had kept her alive when everything around her was burning. "Yes, doctor," she said quietly. She didn't tell him that his encouragement meant nothing. She didn't tell him that she'd saved 17 Marines in a single 18-hour firefight in Helmand Province, that she'd been recommended for a Navy and Marine Corps Commendation Medal that she'd never actually received because the recommendation had gotten lost in classified files. She didn't tell him that starting a difficult for in the United States, with electricity and proper lighting and clean equipment, was approximately 1/10 as complicated as practicing emergency medicine under fire. She just nodded and refilled the medication cart. What Hargrove didn't know What nobody at Sacred Heart knew was that Hannah Clarke had spent 17 years in the Navy as a combat medic. Senior Chief Petty Officer Hannah Clarke. 3 tours in Iraq. 2 tours in Afghanistan. 2 Purple Hearts. 2 Bronze Stars. A career that had ended not in glory but in silence, in a psychiatric ward at Walter Reed Medical Center, in late-night sessions with a therapist who specialized in PTSD and the particular kind of trauma that came from making life-and-death decisions in war zones. She'd walked away from all of it. She'd chosen a new name, new documentation, new credentials. She'd become Hannah Clarke, civilian nurse. Quiet. Deferential. Invisible. But the boots were still in the locker. And the photograph was still in the badge holder. And when the sirens wailed and the codes came and the patients fought for their lives on the stretchers rolling through the ER doors, her hands still moved like they belonged to someone else, someone who'd been forged in places that Hargrove's medical school had never prepared him to understand. The next morning, she arrived at 5:27 a.m. The hospital was quiet, the way it always was before the day's shift began. The water pitcher was empty. The nurse's station was dark. And in the break room, a single cup of coffee sat cooling on the counter, someone's forgotten breakfast. Hannah walked past it without acknowledging it. She had 3 years of experience being invisible. She had 17 years of experience being dangerous. And she had absolutely no way of knowing that in exactly 6 days, a dying man would arrive at Sacred Heart with a mysterious infection, a man who had her name tattooed on his arm, a man who would change everything. The nurse's station at Sacred Heart hummed with the ordinary chaos of a Wednesday morning, phones ringing, keyboards clacking, the smell of burnt coffee lingering from the overnight shift. Hannah Clarke stood in the corner, her badge clipped precisely where it belonged, charting vitals for room for 12. Her handwriting was meticulous. Everything about her was meticulous. She'd been invisible for 3 years, which was exactly how she wanted it. Dr. Hargrove walked in like he owned the tile beneath his feet. Tailored white coat, expensive watch catching the fluorescent light, the kind of presence that made people adjust their posture. He'd hated Hannah since the day she'd quietly corrected his dosage calculation in front of a resident, 10 milligrams of morphine for a patient whose renal function was already failing, when 2 milligrams was the only dose that wouldn't kill him. She'd whispered it, barely audible, a simple correction. He'd never forgiven her for being right. $50, he announced, his voice carrying across the station like he was calling bets at a horse track. Everyone looked up. I'm making a public bet. The timid little floor nurse quits within a week when they assign her to the isolation case coming in from Tikrit. Those protocols? Brutal. 6-7 days max, she'll be gone. Anyone want to take the bet? Laughter rippled through the room like a wave. A resident smirked. 2 nurses exchanged glances. The unit clerk pretended to be very interested in her computer screen. Hannah didn't look up from her charting. Her pen didn't pause. Her jaw didn't clench. She was a master of not existing in moments like this, of letting cruelty pass through her like wind through a screen door. But something inside her, something she'd buried deep, something with 17 years of muscle memory, noted the tone, catalogued the threat, filed it away. Hargrove's eyes found her in the corner. He was waiting for a reaction. A tremor. A flinch. Something to prove he'd landed the shot. Hannah turned a page in the chart and kept writing. Room 412's potassium was elevated. She documented it with the precision of someone whose entire body was controlled by will alone. The moment passed. Hargrove moved on to terrorize someone else, but the damage was done. The whole station knew now. The timid little floor nurse had an expiration date. That afternoon, the cafeteria was crowded with the 3 o'clock lunch rush, the shift change meeting point where everyone pretended they weren't eating hospital food that tasted like cardboard soaked in despair. Hannah had managed to get to the front of the line, her tray balanced on both palms, chicken soup, crackers, coffee that might have been brewed sometime last week. She was navigating toward an empty table near the window when she passed Hargrove's seat. His leg extended. It wasn't dramatic. It wasn't obvious to anyone but Hannah. Just a slight obstruction, the kind of thing you could deny if anyone asked. Her tray was sudden flight, gravity asserting itself with brutal efficiency. The bowl shattered against the white tile. Soup splashed across the floor like a crime scene, broth pooling, crackers exploding into fragments, her coffee cup rolling toward the trash can in a perfect trajectory that somehow felt choreographed. The cafeteria went silent. 50 conversations stopped. Forks paused midway to mouths. Everyone turned to look at the spreading disaster and the woman standing in the center of it. Clumsy, Hargrove said without looking up from his phone. His voice carried perfectly through the dead air. Guess that's why they keep you on floor duty. Physical coordination's not your strong suit. He smiled at his plate. A few nervous laughs started up, then died. Hannah knelt slowly. Her hands were steady as she picked up bowl pieces, her movements controlled and efficient. Other staff looked away, suddenly very interested in their meals. Nobody offered to help. Nobody wanted to be associated with the woman on the floor, cleaning up her own humiliation while the man who'd caused it sat 10 feet away, untouchable. Her face flushed. She felt the heat climb her neck, creep across her cheekbones. But she kept her hands moving, kept her breathing level, kept her eyes on the mess in front of her. Pain was information. Humiliation was just another type of data. She'd trained for worse. She'd survived worse. What Hargrove didn't understand was that she wasn't actually the person he was bullying. That woman had died in Tikrit 15 years ago. The next morning came fast and hard. The ER was in that peculiar chaos that only a Wednesday could bring, a motorcycle accident coming in, a kid with an allergic reaction in Bay 3, a drunk who'd walked in demanding pain medication. Hannah was working triage, her movements quiet and efficient, when Dr. Hargrove walked past with a patient chart in his hand. He didn't hand it to her. He threw it. The metal clipboard clattered across the linoleum floor with a sound like a dropped rifle. Papers scattered like white leaves. The thud echoed through the entire bay. 30 voices stopped mid-conversation. Residents looked up from their computers. The trauma surgeon paused in the middle of giving orders. "Pick that up, sweetheart, maybe you'll learn something about medicine while you're down there," Hargrove said, loud enough for everyone to hear, his smile the kind a predator wears right before it bites. The room went absolutely silent. Hannah stared at the chart for 3 full seconds. She didn't move. She didn't react. In those 3 seconds, she made a calculation that would have impressed a ballistics computer, where Hargrove was standing, which staff were watching, whether anyone would actually defend her, and most importantly, what would happen if she responded the way every instinct inside her was screaming to respond. Then a single tear escaped from her left eye. She wiped it away with the back of her hand without breaking eye contact with Hargrove. Her hand didn't shake. Her voice didn't waver. When she spoke, it came out steady as a heartbeat, carrying the kind of weight that made people lean forward unconsciously. "I've held dying men in worse places than this, Doctor, you're just paperwork." She picked up the scattered chart, reassembled the pages with careful precision, and handed it back to him. Their fingers didn't touch. When she walked away, Hargrove's face had gone the color of raw meat. His mouth opened and closed like a fish. Nobody laughed. Nobody moved. The entire ER was staring at him like he was suddenly, irrevocably, smaller than he'd been 30 seconds before. But that wasn't the worst part. The worst part was that Hargrove stood there, humiliated in front of the entire staff, and made a mental note: if she wouldn't break, he'd have to find another way to break her. By evening, the isolation case from Tikrit arrived, and it came with military precision. The transport pulled up to the ER bay at 1900 hours exactly. Not the civilian ambulance type, the military medical transport, the kind with the red cross gleaming against the tan-colored hull. 2 soldiers in BDUs flanked the stretcher. The patient was already fever-flushed, his breathing labored even through the oxygen mask, his uniform soaked through with sweat. The Green Beret colonel was dying. Hannah was in room 347 when they brought him in. She'd been assigned as primary nurse for the isolation protocols, which meant level 4 PPE, the full suit, the sealed gloves, the respirator that made every breath an echo inside your own helmet. The room was already negative pressure, the air moving from outside in, nothing escaping except through HEPA filtration. The infection was unknown. The cultures from 3 different countries all came back negative or inconclusive. Nobody knew what they were fighting. The fever read 104.3 on the digital thermometer. The colonel's eyes were glazed with the particular quality of fever delirium, unseeing, unfocused, drifting somewhere between here and everywhere else. Hannah stepped outside the glass isolation chamber and stared at the man on the gurney. Her breath stopped. She knew that face. Knew the scar tissue on his right shoulder, 2 parallel lines from shrapnel, probably a roadside device. Knew the way he held his left arm slightly rotated outward, a compensation for an old shoulder injury. Knew his voice even though he wasn't speaking, because she'd heard him scream once through a radio transmission at 0300 hours in Tikrit, and that sound never left you. 15 years earlier, she'd carried him for blocks through streets that were active combat zones. An IED had shredded his convoy, Humvee rolled twice, fuel line ruptured, secondary explosions chaining down the street like dominoes falling. She'd run through live fire to reach him, her trauma pack in one hand, her sidearm in the other, moving like something that had already died and didn't know it yet. His blood had covered her from the waist down. She'd applied pressure dressings to his femoral laceration, called in a medevac, and held his hand while they waited for the Black Hawk that seemed to take 1,000 years to arrive. She'd never seen him again after that day. But through the glass, she saw his left forearm, a tattoo in black ink, professional work, the kind of permanent decision someone makes about a person they've decided matters forever. The tattoo read, Clarke. Her name. Carved into his skin like a reminder, like a covenant. The colonel's eyes moved slowly across the room, glazed and unfocused, and when his gaze passed through where Hannah stood behind the glass, he showed no recognition. Nothing. A man in a fever dream, looking at a stranger in a suit made of plastic and sealing tape. Hannah's hands started to tremble. She pressed them flat against the glass window of the isolation room, feeling the cold surface bite into her palms. The trembling wasn't fear. It was something much more dangerous. It was restraint. It was 17 years of controlled breathing and measured responses and being invisible finally meeting the one person who'd actually seen her. Second thoughts. Dr. Hargrove's voice came from behind her, casual and cruel. You can quit now, save us all the trouble of watching you fail. Hannah turned slowly. Her voice came out quiet, measured, steady. I'll take the assignment. Hargrove studied her face for a moment, looking for cracks. Finding none, he smiled, the smile of a predator who decided on his next move and couldn't wait to execute it. Good. Let's see how long you last in there. What Hargrove didn't know, what nobody at Sacred Heart knew, was that Senior Chief Petty Officer Clarke, 18 years of naval service, combat medic, field surgeon, the kind of trained killer who could stop a bleeding artery with one hand while returning fire with the other, had voluntarily walked away from it all 3 years ago. The PTSD had become unbearable. The nightmares where she was back in those streets, carrying bodies that were already gone. The hypervigilance that made her scan every room for exits and elevated positions. The panic that erupted in crowds, in sudden movements, in the sound of helicopters. She couldn't function. Couldn't sleep. Couldn't be around people without feeling like she was holding her breath. So she disappeared. Changed her name professionally, taken a civilian nursing job that nobody asked questions about, rented a small apartment in Raleigh, and built a life so quiet and small it was almost like being invisible. She'd told no one where she'd gone. Not her family. Not her commanding officers. Not the Navy. She'd simply stopped existing as Clarke and became Hannah. Now, standing outside room 347, watching a man she'd saved bleed out from an infection nobody could identify, Hannah felt something inside her beginning to shift. Something she'd locked down hard 3 years ago was waking up. The colonel's fever would spike again in 6 hours. His oxygen saturation would drop. His blood pressure would fall. By midnight, he'd be in full septic shock, and every doctor in the hospital except one would write him off as untreatable. But Hannah was already thinking about needle placement, about the second intercostal space and the midclavicular line, about pressure and precision and the 8 hours she was about to spend keeping a dead man alive. The isolation room sat behind double glass, climate-controlled and sealed, separated from the rest of Sacred Heart by protocol and fear. Hannah Clarke entered it 3 times a day now, vital signs at 0600, assessments at 1400, evening checks at 2200, her entire body wrapped in layers of PPE so complete that nothing remained visible except her eyes. The gown crinkled with every movement. Double gloves made her fingers clumsy. The N95 covered the lower half of her face. She moved through that room like a ghost, present but unrecognizable, a figure in white that bore no resemblance to the woman who'd held this man's hand in a Tikrit courtyard 18 years ago. The colonel lay in the hospital bed with machines breathing for him. A ventilator hissed its mechanical rhythm, pushing oxygen into lungs that refused to accept it. His fever had climbed to 104.7 degrees on the 2nd day. On the 3rd day, it refused to break. The infectious disease team had run every test available, blood cultures, sputum samples, CT scans of his chest that showed nothing useful, nothing that gave them a target. Bacterial? Negative. Viral? Negative. Fungal? Inconclusive. The hospital had called in 3 consultants. None of them could name what was killing him. The antibiotic protocols continued anyway, broad-spectrum coverage that reached for everything and hit nothing. His oxygen saturation hovered at 94% on the morning of the 4th day. By afternoon, it had drifted to 91. Hannah watched the numbers on the monitor the way a boxer watches an opponent's breathing, looking for patterns, for weakness, for the moment when something fundamental shifted. The colonel's right lung was filling with fluid. She could hear it when she listened with her stethoscope, that wet crackle that sounded like cellophane being crushed inside a metal cage. His chest wall moved with increasing effort. Each breath cost him something. The ventilator compensated, dialing up the pressure, pushing harder to keep the oxygen saturation above 90, and the numbers climbed, 91, 92, 93, only to slip backward again when the machine cycled. On the 4th evening, Dr. Hargrove appeared outside the isolation unit with the hospital administrator and 2 infection control specialists from Duke University. Hannah was inside the room, checking the colonel's peripheral fall line, confirming that the fluid wasn't pooling around the catheter site. Through the glass, she watched Hargrove gesture in her direction, his mouth moving with the precision of someone performing concern for an audience. She couldn't hear the words, but she recognized the choreography. She'd seen it before, the head turned toward the administrator, the slight pause, the pivot back to Hargrove, the slow nod that meant agreement without discussion. They were in the hallway outside her locker when she emerged from the isolation unit, peeling off the outer layer of her PPE, her face flushed from the heat of wearing a mask for 8 straight hours. Hargrove was mid-sentence. Protocol fatigue is a documented phenomenon. When nurses become emotionally invested in patients, they sometimes begin cutting corners, small deviations that compound. The administrator, a man named Richardson who preferred golf to medicine, looked troubled. One of the Duke consultants was taking notes. The colonel's condition is deteriorating, Hargrove continued, his voice smooth as oil spreading across water. I'm concerned that Nurse Clarke's excessive time in that room, well-intentioned though it may be, is creating a false sense of control over an uncontrollable situation. It compromises her clinical judgment. For patient safety, I'd recommend reassignment. Hannah tossed her gloves into the biohazard container. They landed with the sound of surrender. She turned to face the 4 men, her eyes meeting Hargrove's for exactly 1 second before moving to Richardson. His oxygen saturation is 91. His right lung is filling. The fluid is starting to consolidate on imaging. He's not stable. He's declining. Her voice came out like a metronomic pulse, steady, factual, without inflection. Moving him to another nurse now breaks continuity. He needs someone who knows his baseline. Hargrove's smile was the kind a predator wears. His baseline is septic shock from an unidentified infection. His oxygen sat dropped 3 points this shift. You're out of your depth, Hannah. This patient needs experts, not, he paused, the word hanging unspoken. Not a floor nurse. Not someone who corrected his math in front of residents. The administrator cleared his throat. Effective immediately, Nurse Clarke, you're reassigned to post-surgical recovery. We'll bring in ICU staff for the Colonel. Dr. Hargrove's concerns about continuity are valid, but patient safety protocols supersede other considerations. It wasn't really a sentence. It was a bureaucratic inevitability, a checkbox marked, a decision already made before the meeting began. Hannah looked through the glass at the Colonel's silhouette, the rise and fall of his chest synchronized with the ventilator's hiss. His fever-glazed eyes were open but aimed at nothing, at the ceiling, at the fluorescent panels, at some middle distance between consciousness and the encroaching dark. She'd been in this room for 72 hours, and in all that time, he hadn't once looked at her? Hadn't once shown a flicker of recognition. The tattoo on his arm, her name, inked in letters that had faded from blue to grey-blue over 18 years, meant nothing to him now. She was just a shape in white, just a nurse, just the person who adjusted his foot drips and recorded his vitals and tried to keep him breathing when everything inside him was shutting down. She nodded once, pulled her scrub cap off, and let her shoulders settle into a posture of acceptance. Understood, Administrator Richardson. I'll transfer my notes tonight. What happened after dark was different. Hannah sat in the break room with the lights off, looking at the photograph she kept in her phone's encrypted folder. It was from 2006, taken outside a forward operating base 8 kilometers northwest of Tikrit. She was kneeling beside a younger version of herself, a captain then, lean and burned dark by months of desert sun, her uniform covered in someone else's blood. The man next to her was the colonel, then a lieutenant, grinning like they'd both survived something they shouldn't have. They had. He'd taken a 7.62mm round through the brachial artery, and she'd applied a tourniquet with her teeth while returning fire with her Mk18 in her offhand. 63 seconds from arterial rupture to hemostasis. 36 seconds from first shot to last. He'd asked her name while she was loading him onto the Black Hawk. She'd told him. He'd asked where he could find her. She'd told him she didn't know yet. The photograph was from 2 weeks after that. The night before she'd separated from the Navy. At 0200 hours, the isolation unit monitor screamed. The alarm cut through the hospital's sleeping hours like a blade through silk. Hannah heard it from the break room before anyone else did, the distinctive pattern of the O2 saturation monitor dropping below threshold, 3 short bursts, then sustained. She didn't think. She moved. Her legs carried her toward the stairs, through the corridor, past the nursing station where the night shift was just beginning to coordinate a response. The monitor showed 84% and falling. The ventilator pressure was maxed out at 35 centimeters of water. The colonel's chest was barely moving despite the machine's mechanical insistence. His heart rate climbed, from 118 to 127 to 134, the rhythm of a body shutting down in real time. Hannah pulled on fresh PPE in 30 seconds, movement economy of a surgeon, and entered the room. The colonel's eyes were open now, panic-wide, the fever glaze burned away by the simple animal terror of suffocation. His right side was silent when she listened, no breath sounds, nothing, just the absence of air where air should be. The left side was laboring, compensating, working alone. She knew what this was. She'd done this in sandstorms and in the dark and with nothing but her hands and muscle memory. She grabbed the equipment. 14-gauge angiocath needle. She found the second intercostal space on his right side, mid-clavicular line, ran her gloved finger across the spot where needle would pierce skin and find the pneumothorax pocket. The pressure there was pushing his lung down, compressing his heart, killing him by degrees with every breath the ventilator forced into a chest that couldn't expand. Hold still, she said to a man who couldn't hold still, whose body was in full panic. Just hold still. The needle went in with a hiss of escaping air, that distinctive sound of pressure equalizing, of the pneumothorax releasing, of a man's lung re-inflating microseconds before his heart lost rhythm entirely. The monitor caught it first, oxygen saturation climbing. 85, 87. 89, the heart rate steadied, dropped, found its rhythm again. Hannah moved to call for an attending physician, to inform the night shift that the colonel had just suffered a tension pneumothorax and that needle decompression had been performed, but she stopped. Her hand was on the call button, and she was looking at the colonel's face, at his eyes, which had finally focused on her, at the exact moment she realized he was still seeing through her, through the PPE, through the white fog of professional distance, seeing nothing that would help him recognize who was inside the suit. She pressed the button. The night intensified. The hospital woke up. The monitor alarm pierced the darkness at 0200 hours like a scream. Hannah was still in the building, reviewing charts in the break room, unable to leave, unable to stay away from room 347. The colonel's oxygen saturation was crashing. 88. 84. 79. The ventilator wheezed its mechanical rhythm, working harder, fighting against something it couldn't overcome. Tension pneumothorax. His right lung had collapsed, air trapped in the pleural space, compressing his heart, suffocating him from the inside. She moved before thinking. Muscle memory didn't ask permission. The on-call physician, Dr. Morris, stood outside the isolation room in his street clothes, hadn't even changed into scrubs, staring at the monitors with the expression of someone watching a house burn down and deciding whether to call the fire department. His hands shook as he gripped his phone. "I'm calling pulmonary. Getting a consult before I go in there," he said, his voice thin as paper. "That infection. We don't even know what it is. The risk?" "He's got for minutes," Hannah said. "Not a question. Not a request. I'm calling." She was already moving. Gowning up in full PPE took 90 seconds, N95 respirator, goggles, face shield, double gloves, impermeable gown, booties. The plastic crinkled like insect wings as she worked. Dr. Morris was still on his phone, voice trembling as he explained to someone on the other end why he couldn't enter the room without backup, without protocols, without permission from someone 3 pay grades above him. Hannah entered room 347 alone. The colonel lay on the bed with the stillness of a man whose body was already losing the fight. His skin had taken on the grey-white cast of shock. His chest heaved with each labored breath. The ventilator's alarm continued its electronic shriek, a sound that made your nervous system scream that you were running out of time. She positioned him on his left side with the smooth efficiency of someone who'd done this in Tikrit, with artillery fire rolling overhead, with incoming mortars shaking the concrete walls, with nothing between her and death but steady hands and muscle memory. Found the landmark. Second intercostal space. Midclavicular line. The place where pressure became relief. The 14-gauge catheter went in clean. Firm. Decisive. The hiss of air escaping was the most beautiful sound she'd ever heard. Not the gentle wheeze of a pneumatic system, the violent rush of pressurized air that had been killing him, finally releasing. The colonel's body convulsed once. His oxygen saturation climbed. 82. 86. 91. His eyes fluttered. Still fever-glazed. Still unseeing. Hannah stayed. The infection was secondary now. Sepsis complicated but manageable if you stayed ahead of it. The pneumothorax was the immediate threat. She adjusted the ventilator settings, titrated his oxygen, began a second round of broad-spectrum antibiotics, monitored his vital signs with the precision of a woman who understood that distraction killed patients. Her scrubs were soaked with sweat within the first hour. The PPE made every breath work. Her shoulders ached. Her legs began to shake from the sustained tension of standing in a 96-degree room for longer than her body wanted to sustain. She stayed anyway. That was what you did for your soldiers. The hours compressed into a single, unending moment. Tick the clock. Check vitals. Adjust parameters. Watch the monitors. The colonel's breathing eased around hour 3. His fever began to drop at hour 4. By hour 6, his sepsis markers were trending down. By hour 7, something shifted, his immune system engaged, or the antibiotics finally found their target, or his green beret constitution simply refused to surrender. At hour 8, his oxygen saturation was steady at 94. His heart rate had come down from the 140 range to a sustainable 105. His fever was 101.2 and holding. Hannah came out of room 347 as dawn crept across the Raleigh skyline like slow bleeding. Her face was marked with deep indentations from the PPE, the goggles, the respirator, the face shield pressed into her skin for 8 straight hours. Her scrubs clung to her like a second skin soaked in sweat and fear. Her legs were trembling, but not from fear. The trembling was restraint. The trembling was 8 hours of holding a soldier's life in her hands while every institutional system around her had already decided he wasn't worth saving. Dr. Hargrove was standing in the hallway. He didn't say anything at first. Just watched her emerge from the isolation room with the expression of a man who'd seen an opportunity resolve itself into something far more complex than he'd anticipated. His jaw tightened. His eyes went flat. Then something calculated moved behind his expression, a strategic recalibration happening in real time. Within the hour, he'd made 3 phone calls. Hannah heard about them later, pieced them together from the official paperwork. One to Dr. Patricia Weiss, Chief of Medical Staff, explaining that the isolation protocols explicitly prohibited floor nurses from performing advanced procedures without physician supervision. Another to Mr. Harlan, the hospital administrator, with concerns about unauthorized interventions that could have compromised the infection control protocols and exposed other patients to cross-contamination risk. And a third to Dr. Elena Vasquez at Duke University, an old colleague, someone Hargrove had trained with, someone he'd maintained a relationship with for exactly this kind of situation. By 8 o'clock, Vasquez was on her way from Durham with an infection control audit team. By 10 o'clock, Hannah's badge was confiscated. Security escorted her to her locker while a personnel administrator watched. The locker was small, institutional, smelling of stale coffee and the ghost of 1,000 other nurses' temporary lives. Her jacket. 3 energy drink cans. A change of scrubs. And at the bottom, wrapped in a military duffel bag that had survived 2 decades of transport across 3 continents, the pair of worn combat boots. The security officer pulled them out with the careful attention of someone handling evidence. Combat boots don't look like anything special until you've worn them long enough to imprint your entire history into the leather. These were broken in beyond any modern standard. The left toe had a small scar from a piece of shrapnel. The right sole was reinforced with a piece of duct tape that had been reapplied so many times it had formed a permanent synthetic layer. The laces were frayed. The color had faded from whatever original shade to a dusty tan brown that suggested desert environments and extended deployments. Vintage fashion, the administrator said, almost dismissive. She was holding the formal termination papers in her other hand. Creative, I suppose. Hannah didn't respond. She reached into the locker and removed a photograph, the only personal item she'd kept at work. It was small, creased, 40 years old. A unit photo from 2003. 23 sailors in desert camouflage, standing in front of a military medical facility in Tikrit, everyone squinting against the brutal Iraq sun. She was in the 3rd row, left side. Senior Chief Petty Officer Hannah Clarke, according to the caption on the back. Already a legend by that point, though she didn't know it yet. She tucked the photograph into her bag. The personnel director was reading the charges from a prepared statement, her voice the particular neutral tone they trained administrators to use when delivering professional devastation. Performing procedures outside the scope of a civilian nurse license. Insubordination. Failure to comply with reassignment orders. Unauthorized entry into a restricted isolation room. Breach of protocol. Each charge was technically defensible if you didn't know that protocols were written for normal circumstances and this had never been normal at all. You are terminated, effective immediately, pending a formal hearing in 3 days, the director concluded. Security will escort you from the building. Hannah stood, picked up the duffel bag containing the boots, tucked it under her arm with the same composure she'd demonstrated during 8 hours in an isolation room watching a man die and then not die based entirely on her willingness to act when everyone else decided action required permission. She walked out through the ER corridor as shift change was occurring. The day staff was arriving, removing jackets, clocking in, beginning their rotation. Several nurses glanced up, saw her with security, immediately looked away. There was a physics to professional loyalty that only lasted until it became personally risky. She didn't blame them. She'd done the same thing once, a lifetime ago, when someone else had made a choice to speak truth and everyone else had chosen silence. She passed Dr. Hargrove near the medication distribution station. He smiled. Thin. Sharp. The smile of a man who understood he'd successfully eliminated a threat he didn't understand by weaponizing institutional processes that required no actual competence to activate, only connections and a willingness to fabricate. The smile said, "You are finished." The smile said, "Nobody cares how you saved his life." The smile said, "The system is designed for people like me." Hannah didn't slow her pace. Didn't acknowledge him. Didn't let him see anything in her expression except the same professional neutrality he'd been trying to break for 3 months. If there was anything Dr. Hargrove didn't understand, it was that breaking someone required that person to care about the same things you cared about. She cared about the Colonel. About getting him to the next sunrise. About every other patient on this floor who might someday need her and find her gone. Everything else, the humiliation, the suspension, the destroyed career, those were information about what institutional power looked like when wielded by people who'd never questioned whether they deserved to hold it. The waiting room at the VA hospital 2 days later smelled like they all did, floor wax and coffee and the particular anxiety of people trying to reclaim pieces of themselves that were still deployed in countries they'd left years ago. Hannah sat in a plastic chair that hadn't been comfortable in 2003 and hadn't improved with time, surrounded by veterans in various states of recovery. A man with a below-knee amputation was using his phone to check his work schedule. A woman with a visible tremor in her right hand was filling out forms. An older gentleman with the bearing of someone who'd led men was staring at the wall with the specific focus of someone trying not to feel. She recognized several of them from Tikrit. From Fallujah. From the forward surgical team that had operated out of a reinforced shipping container with generators running at all hours and blood on everything and morphine rationed like ammunition. Men she'd held while they cried from pain that went beyond what bodies should be able to survive. Men she'd saved and men she'd held while dying and men who'd held her hand when the fire started getting too close. They didn't recognize her. Her name was called for her intake appointment. The PTSD screening. The medications adjustment. The panic attacks had returned like an old infection that had never really been cured, only dormant, waiting for the right conditions to become systemic again. She answered the questions with the same composure she'd demonstrated everywhere else. No, she wasn't having suicidal ideation. Yes, she was sleeping approximately 4 hours per night. No, she wasn't drinking more than 1 cup of coffee per day. All lies, clinical and organized and designed to get her through the appointment without intervention. The psychiatrist, Dr. Morrison, was young and had never served. He looked at her file and his expression softened with the particular sympathy of people trying to understand grief they'd never been close enough to touch. "You left the military 10 years ago," he noted. "How are you managing the reintegration?" "Fine," Hannah said. "I work as a nurse. I help people." "And what changed? Why come in now?" She thought about the Colonel's eyes, still unseeing after 8 hours of keeping him alive. She thought about Dr. Hargrove's smile. She thought about combat boots being dismissed as vintage fashion. "I had an incident at work," she said. "I performed a procedure I was trained for. They terminated me for it." Dr. Morrison nodded as if this was perfectly predictable. As if the system punishing competence for stepping outside institutional hierarchy was a routine event rather than a catastrophic breach of everything she'd understood about merit and recognition and what you were supposed to get in return for knowing how to save lives. Sometimes, he said slowly, reintegration isn't about forgetting what you learned. It's about learning which systems are actually worth serving. Hannah didn't respond. She was thinking about the colonel's daughter. About what Atlas meant if you'd served in a theater where call signs were earned in blood and earned slowly and only given to people whose presence on your team meant you'd come home. She was thinking about whether the system at Sacred Heart Hospital was worth serving, or whether she'd made a mistake 6 months ago believing that civilian hospitals operated under the same code of honor as combat medical units. The termination hearing was scheduled for 0900 hours on a Wednesday morning. She'd received the formal notice the day before, each charge printed in clinical language designed to make her appear reckless rather than skilled. She wore her civilian clothes, dark pants, a blue blouse, her hair pulled back the way she always wore it. Professional. Composed. Surrendered. She walked into room 347 on the way to the administrator's office, passing by the glass where the colonel lay awake for the first time since his fever had broken. His eyes were clearer. His breathing was unlabored. The isolation protocols were relaxed. The infection was responding. He was going to live because she'd known exactly where to put a needle and hadn't waited for permission. His eyes met hers. Something moved in his expression, a flicker of recognition that came and went too quickly to hold. His lips parted. His daughter, Captain Hannah Clarke from Fort Bragg, was sitting beside him reading a letter. She looked up, confused by her father's sudden focus. The colonel's voice was rough from the ventilator and the infection and 5 days of his body fighting for its own survival. Single word. Barely audible. Atlas. 2 days after her suspension, Hannah sat in a waiting room at the VA hospital in Durham, surrounded by men and women whose scars she recognized, not the kind you could see on skin, but the kind that lived behind their eyes. A Marine corpsman with a prosthetic left leg. A female Army medic missing 3 fingers on her right hand. A Navy SEAL whose hands trembled as he held a cup of coffee. Hannah had treated half of them in field hospitals 12 years ago, in places where the heat made the air shimmer and every sound was a potential threat. They didn't recognize her now. She was just another broken veteran in scrubs, waiting for her psychiatric evaluation, her medical file reduced to a single word on the intake form, suspected PTSD. The weight of it pressed against her chest like a collapsed lung reinflating at the wrong speed, each breath coming in fractional increments, each exhale a conscious choice. Her hands, steady enough to perform emergency procedures in a combat zone, now trembled as she filled out paperwork. The VA counselor had asked her when the symptoms started. Hannah couldn't answer. She'd walked away from the military to escape this exact feeling, the suffocation, the hypervigilance, the sense that the world was held together by a thread thinner than spider silk and only she could see how close it was to breaking. Sitting in that waiting room surrounded by ghosts of her own making, she understood that you can't outrun what you've done. You can only pretend for so long. The morning of her termination hearing, Hannah was escorted down the hallway at Sacred Heart by hospital security, a formal proceeding, though everyone knew the outcome was already written. She passed room 347 where the colonel lay, his eyes still unfocused, still looking through her without recognition. The infection had broken, finally. His fever had dropped. His oxygen saturation had climbed back to normal. He would live because of what she'd done in the darkness at 0200 hours, because she'd moved without hesitation, because muscle memory had taken over and her hands remembered what her voice couldn't say. But that wasn't the worst part. That wasn't what stopped her heart cold. The colonel's eyes cleared. Just for a moment. Just long enough to focus on her face. And from his throat, barely above a whisper, came a single word, Atlas. His daughter was there, visiting from Fort Bragg, standing in the doorway of his room. She was young, maybe 30, with her father's sharp features and his eyes the color of winter sky. When she heard the word, something shifted in her expression. She stepped into the hallway after Hannah and the security guard. "Wait," she said. "What rank?" The question hung in the air like static electricity before a lightning strike. Rank. Not a name. Not who is that, but what rank? A daughter who knew that her father didn't whisper the names of nurses. He whispered the names of soldiers. The names of people who'd held him together when he was falling apart. Hannah didn't answer. She kept walking. But one of the nurses in the hallway, Rodriguez, a trauma nurse who'd served in the Navy before her discharge, looked up from her medication cart with something like sudden understanding flickering across her face. Rodriguez's hands shook as she turned the next page. "Bronze Star," she whispered. Peterson looked up, his eyes narrowing. "Another Bronze Star. 2 Bronze Stars, and you were teaching people how to apply gauze in a civilian hospital for 3 years while they called you timid." "There's more," Rodriguez said. Her voice cracked. "Purple Heart. 2 of them." And as she stopped, reading ahead, her lips moving soundlessly. When she looked up at Hannah, there were tears running down her face. Navy and Marine Corps Commendation Medal for leading a combat medical team through 18 consecutive hours of hostile fire at FOB Salerno. "You led a team." "You?" Peterson stood. He walked to Hannah and looked at her with something like respect mixed with the kind of anger that comes from understanding exactly how wrong you've been about someone. "You saved that colonel," he said. "It wasn't a question. You performed an emergency needle decompression on a tension pneumothorax in an isolation unit without authorization, in the middle of the night, while a doctor you work for actively wanted you to fail. That was you." Hannah's voice, when she spoke, carried the weight of 1,000 decisions made in fractional seconds. "He was dying. I was there. The choice was simple." The room went so quiet you could hear the fluorescent lights hum. Peterson's hands opened and closed once, like he was trying to process the idea that a woman he'd seen in the cafeteria, dismissed as quiet, had saved a patient's life with the kind of precision that only came from experience most people couldn't survive. "Dr. Hargrove is," he started, but he didn't finish, because his phone had already rung. The call was from the FBI. They'd been investigating the infection outbreak for 6 weeks, tracing the pathogen to contaminated equipment in the isolation unit. They had questions about access logs. Dr. Hargrove's name appeared 17 times during off hours when he had no clinical reason to be present. By that afternoon, the infection control investigator from Duke had received photographic evidence showing Hargrove entering the isolation unit without proper personal protective equipment, touching sterile surfaces, and leaving. The evidence pointed to only one conclusion: he'd contaminated the isolation unit deliberately, trying to create conditions where his sabotage would go unnoticed, where the infection would spread, where Hannah would be blamed for protocol violations. But that wasn't the moment his career ended. That came when the IT director, a Marine named Torres who'd been monitoring security footage since the colonel arrived, watched Hargrove slip away from the hallway where Hannah's identity was being revealed. Torres's monitors showed Hargrove going directly to the security office, logging in using an administrator password he shouldn't have possessed, attempting to delete footage from the isolation unit covering the past 5 days. Torres had already saved every frame to an external hard drive. He called the FBI directly, then walked downstairs to the security office and found Hargrove's hand still on the keyboard. "You contaminated that unit," Torres said quietly. His voice was steady as a surgical laser. "You wanted the infection to spread. You wanted her to fail." Hargrove's hands froze. "You have no proof." Torres held up the external drive. The size of a human thumb. Containing every second of footage from the past week. Every frame. Already with federal authorities. "The colonel almost died because you sabotaged isolation protocols to destroy a nurse who made you look bad 3 years ago. Because she corrected a dosage calculation and you couldn't accept that a woman with quiet hands knew more than you did." By evening, FBI agents arrested Hargrove in the hospital parking lot for obstruction of a federal investigation, evidence tampering, and reckless endangerment. His medical license was suspended pending criminal charges. The hospital's legal team moved faster than his lawyers could respond. By the time news outlets ran the story the next morning, Dr. Hargrove was no longer a doctor at all. 6 months later, Hannah stood in her dress uniform Navy service blues at the colonel's retirement ceremony at Fort Bragg. The uniform was the blue-gray color of a winter sky, her ribbons and medals restored to her chest, 2 bronze stars, 2 purple hearts, the Commendation Medal, each one a story of choices made under fire. The colonel stood beside her in his green beret dress uniform, recovered fully, his breathing easy and his eyes clear. The ceremony was held in a climate-controlled hall with white tablecloths and a podium where senior officers spoke about service and sacrifice. But what mattered was the shadow box. Hannah placed her worn combat boots in the center of it, the same pair she'd worn in Tikrit, the sand still embedded in the treads despite 3 years of civilian life trying to wash it clean. Beside the boots lay the colonel's green beret flash, his medals, and a single photograph of both of them taken 12 years earlier in front of a mud brick structure, both of them impossibly young, both of them still believing they'd survived the war intact. The colonel touched the tattoo on his left forearm, her name, Clarke, inked in simple black letters beneath the date she'd saved him the first time. He smiled, and his voice was steady as a heartbeat. "I got this the day after you pulled me out of Tikrit. Took me 15 years to say thank you." Hannah's response carried the weight of everything she'd endured, the humiliation, the suspension, the PTSD that still came in waves, the choice to return to Sacred Heart as a per diem trauma nurse rather than accept the promotion Peterson offered. "You don't thank family, Colonel. You just show up." In Raleigh, Dr. Hargrove taught CPR to bored teenagers at Raleigh Community College for minimum wage, his hands trembling as he demonstrated chest compressions on a plastic dummy, his medical license permanently revoked, his reputation atomized, his legal fees bankrupting him at a rate of approximately $3,000 per week. Nobody called him doctor anymore. Nobody called him anything but his first name, spoken with a kind of distance reserved for people who'd fallen so far they were no longer worth the energy of contempt. Hannah's first night back at Sacred Heart, she wrote on the staff whiteboard in her careful handwriting, "True class is what you do when the lights go out." The nurses who'd watched her get humiliated 6 months earlier stood when she entered a room. The younger nurses asked her about her tattoo, a tiny anchor on her wrist, barely visible, marking her as belonging to something larger than any single institution or hierarchy or man with power. She wore her combat boots to every night shift now, the leather scuffed and worn, the soles bearing the imprint of sand from 3 countries. They were no longer hidden. They were no longer denied. They belonged to her, and everyone who saw them understood that quiet people sometimes carry the heaviest weight. If you've been underestimated because of who people thought you were instead of who you actually are, drop a comment below, because the people who change the world are rarely the ones making the most noise. Subscribe for more stories of hidden strength, and hit that bell so you never miss a video. Thank you for watching.